This Your Health, Your Decision special on emergency services is brought to you by Conway Medical Center and WPDE News Channel 15.
If you or your family have a medical emergency, you may turn to an emergency department and the professionals who work inside. More than 46,000 people visit the emergency department here at Conway Medical Center every year. Over the next 30 minutes, you'll get an inside look at this department, how it all works, the high-tech equipment used to treat patients, and the training it takes to work here. About a year ago, the entire department was renovated and revamped. And one of the biggest changes was in triage. That's the first place you visit when you make a visit here.
Hey, how are you? Can I help you?
7-year-old Logan Johnson came to the emergency department of Conway Medical Center for a rash on his skin. When he walked through the door, a nurse immediately started to assess his condition.
The department receives patients, ambulatory patients walking through the door, and by the EMS system. And the percentage is probably 15–20% EMS and the remainder is ambulatory. So the job of the triage nurse, which is a very difficult job and not an envious job for anyone, is that they have to shift through this at sometimes an overwhelming number of people presenting at the same time and decide which ones need care and in what priority. Of course, they all need care, but which ones need more emergent care than others?
To work as the triage nurse, you must first have worked in the emergency department for at least a year.
Over time, you can almost look at someone and say, okay, I've got a minute to ask you what your name is and what's going on, or no, I don't. And I can put you in a wheelchair, rapidly assess you as we move, and put you in a room and continue that assessment.
In this case, Logan goes back to the minor care area.
Have a seat on the bed.
This is a new area created when the emergency department was renovated about a year ago. The department is now divided into 3 sections: the 4-bed minor care area, Section B, which is for patients who need more acute care and monitoring, and the trauma beds for the more serious injuries or illnesses.
Hello, hi, my name's Lauren.
In the minor care area, Logan sees Lauren Wiley, a physician's assistant, who examines his rash and talks with a supervising doctor about the care.
He does have an area on his right ear. It's all external.
It frees up rooms in the critical care area of our department and our trauma area. It's a nice extension. They call them physician extenders, and we closely supervise them.
He's my supervising physician. He's just going to take a quick look.
In Logan's case, he just needs an antibiotic.
Rash is a tough thing to distinguish what kind of rash and what kind of treatment. A lot of times it's you look like the guy with all the answers because they've already had a trial of another treatment from another doctor, and you know it failed. So in this case, it was impetigo, needing antibiotics, and it was a simple matter. And we always refer back to the primary care doctor when they have one.
And in less than an hour, Logan and his family are in the discharge area, ready to go home.
Emergency medicine is one of the nursing venues where you can have a great deal of variety. You never know what's coming through the door.
And Nancy would know.
When did this pain start?
She's been a nurse in emergency medicine for about 25 years and has spent the last 15 years at Conway Medical Center's emergency department. She's seen the changes over those years.
When I first came to work at Conway Medical Center, triage was a kind of a newish concept and was essentially a chair and a table, a piece of paper and a notepad, a curtain perhaps, you know, when the curtain was there. And we have progressed from that point forward to multiple different types of triage, of computer skills, of technology that allows us to assess a patient almost before they hit the door, to rapidly get them moved into the appropriate room or space in our department in order to have them treated with what they need and what we have available as quickly as possible, and continue that concept from that point on to a transfer status, an inpatient status, or an at-home status, with the aid of bedside computers, with the aid of mobile computers, mobile registration, and multiple other things that are available here at Conway Medical Center.
That bedside registration means there's a computer that is taken to the patient's room, and all of their information is entered right there.
Ms. Walls, when's your date of birth?
It has made the transition from triage to the bedside more comfortable for the patient. When the patients don't feel well, you don't want to stop at a desk and go through paperwork. So we cut that whole process out, bringing the patient straight back from registration to the bedside to where they're more comfortable to do their paperwork and get their insurance information.
The doctors and nurses also have computerized charting.
We can bedside chart and order right there, and where you are, and not having to leave the room or leave the bedside, so that a nurse and a physician and any necessary technicians can be in the room taking care of the patient rapidly without having to leave the immediate vicinity.
And everything they need is right at their fingertips.
We are able to go ahead into that database and obtain that information, which is very important in emergency medicine, because sometimes a patient doesn't have the ability to give you a thorough history, whether they're unconscious from a trauma or they're feeling ill for other reasons and are confused. So we're able to get that. We're able to pull up old x-rays also, the images of old x-rays, and compare them to the x-rays that we're obtaining for the patient's condition.
And there are large computer monitors at the nurses' station, where all patients in the emergency department can be tracked at the same time.
We use a system here at Conway Medical Center called MedHost, which is a ER-specific emergency department information system. It basically is an all-inclusive system where we do our registration all the way through discharge. Physicians do their order entry. Nurses do all the documentation through the system and electronically. It also allows us to track the patient's flow through the department. For example, it lets us know if we have patients waiting at triage, how long the patient has been waiting at triage. It also gives the charge nurse the capability of quickly looking to see if there's any bottlenecks, if we have a lot of patients up for discharge or what is a holdup for discharge. It's an icon-driven system, which is great for the nurses because you don't have to read a lot of orders. It takes away the old clipboard where the physician would write the orders and then hand it off to the secretary. Then the secretary would put the orders in. Then the secretary would give the clipboard to the nurse. So electronically, all that is totally done away with. And physicians put their orders in, and as soon as the physician puts their order in, it alerts the nurse via icons on the board what's pending. If it's a medication order, there's a small pill that starts flashing. If there's a lab order, it's a test tube that starts flashing, or an x-ray, a bone that starts flashing. So it's very simple, very icon driven, yet at a quick glance the nurse or the physician can look and see what the status of their patient is.
The top number shows how long the patient has been in the emergency department since registration. The bottom number is how long it's been since a nurse has had interaction with the patient.
An example of our icons is a physician has just put an order in the patient up here in room 2, and you see the pill icon flashing, and it's colored pill. That indicates that a new order is there for the nurse to look at, and since it's a pill, the nurse knows it's a medication. There are 3 stages of completing an order. One is a physician order, and then the nurse looks at the order and verifies the order, goes in and prepares the order. Once the nurse verifies and prepares the order, then the icon will stop flashing, but it stays in the color status. And then once the nurse has completed the medication and given the medication to the patient, then it grays out and no longer flashes. So that lets you know your medication has been given to the patient. Since it's an electronic system, physicians no longer have to wait for radiology results to be faxed over or lab results to be faxed over. As soon as the lab verifies the results, the physicians get an alert with the system, as in right here, an example here. The lab tube is flashing, it has a little green tag on it. That's to alert the physician his lab orders have been completed and they're ready for the physician to view.
And getting those lab results has changed too. Instead of waiting on someone to take the samples across the hospital campus to the lab, they use a chute system.
We have a tube system so that there's no delays any longer in getting things to the lab, getting them back. You drop them in a tube, whoosh, they're gone, just like at the bank.
So having the lab chute was a monumental step. You can imagine, we're seeing 150, 160 patients a day. In the past, we would batch some of those lab samples to save somebody having to walk back and forth. Now the samples are immediately sent over, so it speeds up turnaround time.
The emergency department also has portable x-ray machines available.
Trachea's midline, I'm happy with that. The heart silhouette is a normal appearance. Diaphragms also appear normal.
And they have ultrasound equipment as well.
We've introduced over the last 6 years in the department ultrasound technology. It's useful to rule or to evaluate for an emergent medical condition that requires something at the bedside immediately. Now, of course, the hospital still has, and luckily so, 24-hour availability of radiology services, including ultrasonography. But the point is that in the emergency department, you really have a plethora of different modalities, different technologies that are immediately available, again, to emergently diagnose and manage whatever basically walks through the door and do it well.
Some of those patients are diagnosed and treated inside a trauma room. Coming up, we have a look inside one of those trauma rooms and the equipment that the doctors and nurses have available to them.
Home. It's where the heart is. And at WPDE News Channel 15, understanding the importance of community means we always go where the story is, regardless of where it takes us. Our purpose, our spirit, core of who we are has always been to provide the Grand Strand and PD's most trusted news coverage. It's our promise and our commitment to you.
Don't let weight define who you are. Obesity is one of the biggest health threats in America. Nearly 1/3 of us are obese, and South Carolina ranks 8th in the nation for obesity. Coastal Metabolic and Bariatric Surgery offers gastric banding, sleeve gastrectomy, and gastric bypass. Many weight loss surgery patients see lower blood sugar and better blood pressure after surgery. Experience the change in your body, weight, and health. Start by attending one of our free seminars. Regain control of your life.
Reality. The reality of life can be described in many ways. But one reality has never changed. WPDE News Channel 15 is your choice for the most trusted news coverage. Our purpose, our spirit, the core of who we are has always been providing quality journalism. And the reality is, no one will ever match that.
HeartSaver CPR AED from the American Heart Association teaches adult, child, and infant CPR and AED use, as well as how to relieve a choking adult, child, or infant. It's a video-based instructor-led course which allows instructors to observe the students, provide feedback, and guide the students as they learn the skills. You can take this course on Tuesday, October 23rd at 4 p.m. at Conway Medical Center. Go to carolinalive.com for more information. It's your health, your decision.
Choosing the right wallpaper for baby's nursery is hard. Choosing the right hospital is easy. Choosy parents choose Conway, the birthplace at Conway Medical Center.
Welcome back. The majority of people admitted to the hospital come through the emergency department, and the equipment used to treat them has changed dramatically over the last 20 years.
The very earliest department that I came to work with, we had monitoring capability for heart patients, but only in a few rooms. And that was, it was what it was for the time frame. We had a defibrillator, and you moved it if you needed it to where you needed to have that. Charting, of course, was all done on paper, and people kind of fought for that paper at times. Now all the rooms are cardiac capable. All the monitoring can be done remotely. The monitors are astonishing. I mean, you can set them up the way you want them, and they can spit out reams of information that's available to you to know the status of your patient. You can also be in one room if you have two patients and actually see on your monitor what's going on with the patient in the next room if you have to keep up with them.
This is our trauma room. It's a room that has specialized equipment set up to handle emergent situations. Of course, any equipment in this room is portable and is able to be moved quickly to any room in the department if we were to need it in other areas of the department. Say if we had a pediatric patient who were to come into the emergency department who was in any type of distress, we have a Breslow cart here. It is a color-coded cart that is set up and it's based on patient's weight. And the way that we can get a quick estimate is that we have a Breslow tape. The child will be laid on the stretcher. The tape will be quickly unrolled. You measure from the top of the head to the base of the child's heel. And we would say this patient is a 12 to 14 kilogram patient. We will quickly go to the cart. It's a yellow. So you pop the cart and you would put out the yellow drawer. And all of your emergency supplies that you would need to take care of the patient are in the drawer as far as airway management and IV management. Also on the tape is the pre-calculated doses of medication that you would need in an emergent situation on the child, so that you don't have to take the time to stop and do all the calculations manually. This is all pre-calculated for you based on the child's weight in kilograms. For adults, we also have an adult emergency airway cart. This is equipped with a fiber optic scope and also has different trays that we would need for different kind of adult emergency airway situations where the physician quickly has all this accessible at his fingertips. Again, this is very mobile. We could move it to any room that we would need in the department. We also have a glide scope, which is one of the latest technologies in intubation. It is a fiber optic scope that also has a camera attached to the end of the scope where the physician would be capable of doing what we call a monitored intubation. There's a scope here. So rather than going into the patient blind, what we call a blind intubation, they will be able to actually follow the blade all the way and pass it safely through the cords. Two advantages to this is it's a lot quicker for the physicians, and it's also less traumatic for the patient. Throughout the department, we have what we call our crash carts. These are carts that are put together with your first line, second line medications. Also has an intubation roll for physician or respiratory therapist use on top. There are IV supplies and multiple central line supplies. All this is in here. We also have our defibrillator that's attached to each of the carts, so if the patient were to go into any kind of shockable rhythm, you would quickly turn it on, attach it to the patient, turn it on.
Push analyze. Remove test plug.
Charge it up, and then for safety, you always make sure that everyone is clear and no one's touching the patient. You say clear, and then you give the patient the shock. And it's a handoff procedure. Again, safety purposes, you don't have that possibility of having an electrical shock given to the caregiver. It's all driven to the patient with a hands-off capability. We also have our supply cabinet in our trauma room. This is a cabinet that we set up specifically to address any type of emergent situation, whether it be pneumothorax or a collapsed lung. Emergency airway equipment also is located in here. Emergency IV equipment, neck stabilization equipment. If a patient were to come in with a neck injury or suspected neck injury, quickly grab a stabilizer out of here, attach it to the patient to give a more stabilization to the patient.
And the technology is needed because in an emergency department, you never know what will come through the doors, whether it's a child hit in the head with a golf club or a man bitten by a snake.
So the good news is we won't be giving you anti-venom. We don't have to take that risk. It's a very local infection.
Emergency medicine, you have to be a jack of all trades. You get to see all different aspects of medicine, but at the most emergent or urgent time. So I found during my medical schooling that I liked the energy and a bit of an adrenaline junkie, if you will. So it was most interested me the fact that you could do a lot of great things, a lot of beneficial things right away in the most critical hour of a patient's condition.
When an ambulance is on the way with a patient, Horry County EMS can call ahead and let the emergency department know what to expect.
We have two capabilities that are kind of important regarding that. One, we have the capability to receive EKGs or electrocardiograms on patients. So in the appropriate situation, we can adequately prepare for that patient. The second thing that is important with Horry County EMS is that they just upgraded their radio transmission system. I think within the last 6 months or so, the new system was put in place here.
A lot of changes. Coming up, a look at the training it takes to work in the emergency department and how this department can actually be moved off-site.
Passion. Without it, the best you can hope for is mediocrity. For WPDE News Channel 15, our passion is quality news coverage, keeping the Grand Strand and PD informed with unrivaled accuracy and professionalism. It's our purpose, our spirit. It's the core of who we are. Anyone can cover a story, but it takes passion to make a difference.
There's no replacement for the activities you love, but there is replacement for diseased or damaged joints that keep you from enjoying life. Conway Medical Center is leading the way with the most advanced hip, knee, and shoulder joint replacement in the region. Our experienced team and fellowship-trained surgeons know what works to minimize pain, get you home from the hospital sooner, and return you to an active lifestyle. Call us or visit conwaymedicalcenter.com for dates of our upcoming joint replacement seminars.
HeartSaver CPR AED from the American Heart Association teaches adult, child, and infant CPR and AED use, as well as how to relieve a choking adult, child, or infant. It's a video-based instructor-led course which allows instructors to observe the students, provide feedback, and guide the students as they learn the skills. You can take this course on Tuesday, October 23rd at 4 p.m. at Conway Medical Center. Go to carolinalive.com for more information. It's your health, your decision.
Don't let weight define who you are. Obesity is one of the biggest health threats in America. Nearly 1/3 of us are obese, and South Carolina ranks 8th in the nation for obesity. Coastal Metabolic and Bariatric Surgery offers gastric banding, sleeve gastrectomy, and gastric bypass. Many weight loss surgery patients see lower blood sugar and better blood pressure after surgery. Experience the change in your body, weight, and health. Start by attending one of our free seminars. Regain control of your life.
Get the latest updates on what's going on in your area with the News Channel 15 mobile app. View the local weather forecast, access local news, and purchase daily deals. The News Channel 15 mobile app, available now on iTunes and Android app stores and on carolinalive.com. Presented by Palmetto Corp. Palmetto Corp has over 25 years of experience building projects such as churches, office buildings, restaurants, and recreation centers. For proven quality construction, call Palmetto Corp today.
When they come to work, the professionals in an emergency department never know what that day may bring, and that's why it takes training and certifications to work here.
To work here in Conway Medical Center ED, we need to, of course, be certified all nurses in basic life support, as well as advanced cardiac life support, as well as pediatric advanced cardiac life support as well. Many nurses also on their own go ahead and are certified in TNCC, which is Trauma Nurse Core Curriculum. And I think we probably are greater than 50% of the nurses here have taken it at least one time, and many stay certified right on and on.
In an emergency department, every day brings different patients with different illnesses and injuries.
You can come to work and say this is really going to be a very easy day and go from not a single patient in the department to 30 patients in the department in the twinkling of an eye. You really never know what's going to come in the door. You must be prepared both mentally and equipment-wise for anything that happens as quickly as it happens.
Another aspect of being prepared is being able to call on other specialists like orthopedics, general surgery, and cardiologists.
Fortunate to have a radiology group that is available 24/7, so I can pick up the phone and say, well, what do you think of this, and what sort of follow-up, do we need another x-ray done, or what needs to be managed in this case. Not only that, we have the availability of the specialists of the center that maintain a call schedule are immediately available.
Something that's available for the community is this emergency department can mobilize a 75-bed alternative care site hospital.
We are one of only 5 hospitals that are certified within the state of South Carolina to do this via DHEC. It means that what we can do in the event that we were to lose either our physical building here, or there were to be some kind of a disaster or something else that were to occur where we would lose capability of other facilities, we can actually set up a 75-bed mobile low to intermediate care area where we can triage, we can administer IVs, we can administer medicines, we can continue on the basic work of an emergency department or a hospital actually away from the facility.
For the 89 physicians, nurses, and techs who work in this department, it can be difficult seeing someone on what may be the worst day of their life. So, why do they do it?
And when you get that patient that's very critical, when the patient comes back the next week or the family members come back and say thank you, or receive that letter from that family member, that makes it worth it. That makes the 12-hour shift worth it. Just being able to dedicate my life to bringing better health to others is just a fulfilling. It's just a wonderful feeling.
That's a look inside the emergency department. For more on emergency medicine, go to carolinalive.com. It's your health, your decision.